Hmm. Good evening, everybody. Welcome to the Rehabilitation Science Group. We are with another interesting topic, evidence-based practice simplified. Today, we are having Dr. Dharam Pandey with us and Dr. Harpreet Singh. I would request Dr. Harpreet Singh to kindly tell about the Dr. Dharam Pandey and the topic.
Yeah, good evening, Dr. Shagun. Good evening, Dr. Dharam. It is a pleasure to have you with us. And first of all, I would like to introduce Dr. Dharam as a member of the Rehabilitation Science Group, and he has a very important role in the formation of this group for advancement of science in rehabilitation. And taking his academic career forward, Dr. Dharam Pandey is a PhD in rehabilitation science and physiotherapy. He has multiple interests and degrees, including manual therapy, osteopathy, chiropractic, and vestibular rehabilitation. With multiple awards and honors on his name, and a lot of more than 100 talks on health and rehabilitation, with 19 scientific publications in journals of international and national repute. Dr. Dharam Pandey has varied interests in stroke rehabilitation, motor learning, motor control, vestibular rehabilitation. So it is a pleasure and an honor that Dr. Dharam Pandey is with us today, explaining evidence-based practice in a simplified way. Thank you, Dr. Dharam Pandey.
Thank you, Dr. Harpreet and Dr. Sagun. It's indeed pleasure for me to present on this platform. And today's my topic is, as you already mentioned, evidence-based practice. I have tried to make it very simple to understand everyone what the evidence-based practice is and why clinicians should adopt this kind of evidence-based practice. What are the different myths? I will try to clear those in our clinicians. So before I start further, I have just 4 questions as on your screen, and I would like to answer you one by one, and let's see how we are practicing. So the first question is, what is the basis of your clinical practice? So if you say that your practice is based on training, your clinical experience, and discussing with your fellow professional, so I would say excellent. You are doing a good, great job in your clinical practice. But my friends, don't you think the past knowledge and practice might be outdated or inadequate to have that? Because what we must understand that up-to-date knowledge about our clinical science and our clinical experience should go parallel. It should not mismatch because everything needs change. We have studied from our teachers, and teachers have been taught by their teachers. And if you follow that, the old books and those references and in our experience, then it might be, I don't agree on that it might have an outdated knowledge or it is not updated, because what I believe, the updating knowledge and clinical experience, it should go parallel. So then that is actually, I believe it should be called as a clinical experience. When we call us as an experienced clinician, then we should have an updated knowledge also. Everything need to change. Like for example, you can see on the screen that the outdated old model of telephone and now the smartphone, latest smartphone. And we have a lot of information. We need to have continuous exploration of information what we have day to day. Like for example, if you look at the oldest phone, we didn't have any camera on these phones. We wanted to, and still it was useful for us. It was serving the purpose. But later on, we found that that we should have a camera, we should have an email-friendly mobile devices and all that. Then this is how we develop our phone. So similarly, we need to have certain things. The same example here also. In many years ago, we were relying on only based on the post what we used to send. It used to take many days to reach to its destination, but now we have email on in a single click. We get that the message delivered to the place, right? So just a minute. So just starting. Yes. So, like for example, if we say that neck pain you used to treat and it will take 30 sessions, but why don't we look at that? Is there any way that we can treat this neck pain in earlier? Yes, of course, our treatment is serving the purpose. Patients are getting okay, and their pain is getting relieved. But is there the simple way, more simple way, what we are doing? Is there any way to make this treatment procedure more simple, more beneficial, or a quick recovery? So these are the things comes in mind, but actually you did not bother because you didn't choose that you are practicing on clinical experience. So the next you have chosen that you read article, case reports, products, literatures, and all that. And any convincing evidence what you come across, your practice is, suppose your practice is on dependent on these. So definitely you are doing a fantastic job, and because you are keeping yourself updated, and you are reading articles, you are reading product literatures, how this particular products function. But my friends, again, these evidence may be biased, outdated, incorrect, or not applicable. In many of internet, we use to find out information. They are biased because like for example, I have seen many of articles and find that most of time the researcher or the investigator is biased to prove their hypothesis, and most of time they don't bother about proving null hypothesis, and the most of time this hypothesis has never been proven, because most of those writers and the fake researchers, they make this, and the internet and other places are really having a great source here that we misleading information. Okay, so and again, product monographs. Any company who is which is promoting their products, they might be biased with their products. Like for example, I'm a manual therapist and I'm writing an article in newspaper or somewhere other internet sources. I'll be definitely biased with the manual therapy. Is the manual therapy only works, not the other therapy works? Something like that, some electrotherapy modality, that this product works. And these type of evidences are really not reliable. And this may be biased literatures, biased information with a particular therapy or particular devices or something kind of that. So I don't think that's the correct way of doing our practice. Then the next question comes, if you have chosen preference to patient satisfaction, yes, our clinical practice should depend on the clinical patient satisfaction. It start with patients, it's end with patients, right? So that's, you are doing a really wonderful job. Okay, but my friends, again, don't you think that when we rely completely on a patient satisfaction basis, or we listen to patient, or making patient in a more involving more in decision making regarding therapeutic process, you might have come up with a lot of questions like you can see on your screen. Like if you are giving some suggestions to patient that I'm going to do this, the patient may ask you, oh, Doctor, I have read about this. This is the better way, and that those misleading information from Google, from internet, might affect the appropriate treatment. So this will definitely going to create a conflict, and that will occur between you as a clinician, as an expert, and the patient's knowledge what they are getting from irrelevant sources. Okay, so that is also not the case, but definitely the last one, if you've chosen, you need not to bother, because you're not practice is not dependent above 3 questions. Your practices depend on active search of randomized. You do a lot of search of randomized controlled trials, systemic reviews. You read a lot of meta-analysis report, and you practice based on that. Yes, amazing. That's a wow, superb. You are doing a very good job in your practice. But again, don't forget that the practice based on exclusively on science and math is effective only if your patients are robots. They are all similar. They have all same kind of softwares. They have all they are clone like each other. Don't forget that to allow individual human differences. Okay, so I don't agree that you should rely only on this 4th method. Okay, although it is a very good, but definitely I don't believe on that. Yes, now you have seen that my topic is evidence-based practice simplified, but you'll be thinking that, oh wow, it is very confusing that you're saying this and you are naming it a evidence-based practice, but you are making us confused. No, wait, we will clear you all the confusion further now, right? So what is the basis of your clinical practice? If you choose all these, then congratulations, you are practicing an evidence-based practice. Okay, so we will be talking about all these things, how we can practice evidence-based practice. Rather, I always keep it as simple that evidence-informed practice, that everyone is in need of information, new information, acquired new information, and these new informations we gather, and we with this information we enhance our practice and patient care, right? So what is evidence-based practice? It is change in the way we as a clinician practice, handle research, teach our fellows, and learn new things, right? Very long back in 1980s, when the Sackett is defined as it is consistent, explicit and judicious use of current best evidence in making decision about the care of individual. So it is a judicious use of best evidence available to us, and this is why it is called as a thoughtful integration of a patient values and circumstances, how the circumstances at your place in the clinic, best available research findings, and clinical expertise what you have. So all the amalgamation of all these things, and when you think thoughtfully, that's what the evidence-informed practice is. So there are 3 major components of evidence-based practice, which is called EBP triad. So there is a patient, there is a clinician, we are the clinician, and there is a lot of information available. What is best, what is good, what is right, what is harmful, all these information. So this is ABP, triad, patient, clinician, information. So further, if you go ahead, you look at that, we need to take care of the patient's concern, patient's expectation, patient's preferences, and where the patient is. We need to have a clinical relevant information proven by research and best up-to-date evidences what we can have. And as a clinician, we should have an appropriate training, experience, and current expertise and continued learning, like what the therapy we are. If I'm having a good information about NGT or something like PANF or some kind of therapy, that it works. But if I don't have certain knowledge to implement that evidence and to work in that, it is not going to work out. So we should have an appropriate training. We have a lot of, no doubt, we have a lot of information with us, and but still we need a lot of more information to grow our practice and make patients more beneficial with our therapy. And in fact is that we all have a need for information. We have to have a continuous information flowing in our practice, and we have to keep updating ourselves to make patient care more efficient, right? So as I said, there are various steps in evidence-based practice. There are 5 important steps we need to understand. It is not so difficult, but one by one, when we understand, it is better to understand, right? So the first step, we should have a very well-formulated clinical question, what the problem is, and it has to be patient-focused, patient-oriented. Each patient is different. Each problem is different. The same problem with other patient may differ. So we should have a very clear question in mind, which we are going to finding the evidence for. On that clinical question, we will try to find out what the solution is. We will find out the evidence, what works, what not works. And once we find out those evidences, we need to critically appraise that. We need to analyze that evidence, that evidence works, is going to work with my patient and the current problem, what I'm facing in my clinical practice. The patient I'm treating has a certain problem. Will this evidence, what I have found, applies to this? So this is how, once you think that it is applicable, you will apply that evidence to you in your practice. And that's not the end. At the last, you are going to evaluate that what the question you, what the answer you were searching in evidence, you found that, you applied that, and whether that is working with your patients or not. And here it is why I call it a very important step also, because here you are going to have a basis for further research, further exploration. And it gives you a clue that that what further has to be done. So there are 5 steps. In these 5 steps, there are 2: the clinical question and applying evidence. It is in a dynamic steps. Each patient to patient, it will differ, while that other 3 are static in nature, and there is a certain steps you have to follow. And for every time you search or analyze, it will be the same. This is why I call it as a static. So now let's explore step by step. The first question, clinical question. So it has to be, as I earlier also said, it has to be patient focused, problem oriented. It is the hardest one steps, because the one best question and very relevant question will definitely help you going further. It is a very important aspect also. So yes, when you are presented with a patient, when you encounter with a patient, a case in your clinic, and you are going to flood with details. When you start taking history, you will have a lot of information that the patients, while taking history, and you get very confused that what is going to work best for my patient. It is very difficult to make decision, as a lot of therapeutic tools available to us. So then this is where you are going to make your question and decide what is your focus to search for any evidence. And to find best answer of this clinical dilemma, we need to formulate an appropriate question, what we are going to search. And to make an appropriate question, there is something called PICO tool, P-I-C-O, PICO tool. This tool we use to formulate our question. Once the question is well formulated, the searching for evidence will become easier and more relevant. So as you can see on the screen, P stands for problem, I stand for intervention, C stand for comparison, and O stand for outcome. So let's say, look at with one, understand with an example. Look, for example, here, one 15-year-old boy with low back pain. As there are many options of physiotherapy modality of back pain is available, including exercise therapy, manual therapy, other things. So let us put this case in PICO tool to formulate a good question to make ready for searching the answer. So, okay, right here. So problem, what is the problem? Problem is low back pain. Problem, P stand for problem as well as patient. So patient is 15-year-old and problem is low back pain. And what I'm thinking that what intervention I have a doubt or I want to give to my patient is exercise therapy. But there are a lot of manual therapy approach and other approaches are available. I want to see that whether if I believe that exercise, remedial exercises will definitely help this younger boy to get rid of back pain, I will try some comparison. I'll try to compare my therapy with some other most emerging therapy, that whether which is better for my patients. And what outcome I'm looking? Reduction of LPA. So this is how we use PICO tool to formulate a best question. So probably my question would be, does exercise therapy is most effective, more effective than manual therapy in reducing LBA in teenage male with LBA? So I have formulated a question, manual therapy, exercise therapy, LBA, and younger age. And outcome I'm looking for whether this exercise therapy reduces the pain. Another example here, with a 65-year-old female with osteoporosis. Once you put this in PICO tool, so the patient and problem is 60-year-old female having osteoporosis. The problem is osteoporosis. And I want to see that whether exercise therapy help with osteoporosis. And what I don't want to compare any other therapy, but actually here in a different way, I want something evidence that what works to help with patient, old osteoporotic patient in our intervention. So I will not put any comparison, but definitely I am looking that whether exercise therapy improve bone mass in elderly females. So probably my question would be, does exercise improve bone mass in elderly population? So this is what I'm going to looking for. Is there any evidence? Okay, so moving on, once my question is prepared, I am going to move on to next step, finding evidence. And to find evidence, best available evidence, we have a lot of, we have to look at the various information resources we have available. So there are few key database available here, like PubMed, Cochrane Reviews, Pedro, the physiotherapy evidence database, TRIPS, Hooks on Evidence, APTA, and all that. There are some are paid and some are free of cost, where a lot of literatures available. We have to filter those literatures to find out the best available resources. Like we'll have most popular, we search for PubMed, and I'll look at that to make you understand how we can go ahead with searching these evidences. So before that, we begin search, we have to make that sure that what I'm looking for, whether I'm looking for any diagnostic efficacy, what are the diagnoses or testing or investigation is best for any case. Do I look for any prognostic evidence that what is the prognosis of this patient, this particular therapy or treatment itself. So if I'm looking for diagnostic or testing, the cross-sectional studies, non-randomized trials are best to look at, right? If I'm looking for prognostic evidence, then the follow-up studies of patient evaluated for very long time for any illness, that is those type of studies I'm going to look for. If I'm looking for treatment or therapy efficacy, whether I should use, we can go ahead with the randomized control trial or systemic review of multiple RCTs, meta-analysis, and we should avoid non-experimental study if we are looking for treatment or therapy efficacy. There are other things also like harm, and we can go ahead with cohort and case controlled studies to find out is there then a long-term harm with any particular kind of therapies, right? So having understand that what type of research I'm looking for, so I'll just go ahead with here to how to search on PubMed. So if you go on PubMed, you will find this screen. This is how you will find the screen of PubMed once you go on that. So as you can see here, there is a search box. So what was my question? My question was, does manual therapy or exercise therapy is better than manual therapy? So I'm going to type manual therapy or exercise therapy, right? So if I search this, you will find that there are a lot of research. This is exercise therapy and low back pain. Okay. So because I have filtered this already, so I am getting less result here. I'll tell you how we can search. Okay. So as you can see, there are a lot of research here. It may come up to thousands and thousands of research, right? So what you can do here, the best way is searching. You have to filter these research, okay? Right here, human, I have already filtered. I'll show you how much research is coming on here on search, okay? Right. So as you can see, there are 42,480 results are coming here in your search while you search manual therapy or exercise therapy or low back pain. So what I'm going to do, I'm going to make it more concise to suit and more relevant to my question. Okay, so I don't want that all the research to be included in my research, my search from 1944 to 2020. So what I'm sliding this to, I want only 1 year database. So soon I just 1 year I make, you can see here that the results become 706. So this becomes the narrow. I don't want any abstract only. I want all the full text articles. So I will filter it to full text articles. So it becomes 666 results, which are matching my search criteria. Okay. And now, because I'm looking for a therapeutic intervention, I will try to find out only randomized control trials or reviews. So you can change here, or either randomized control trial. Even I want to more restricted to only systematic reviews, and I just clicked systematic reviews. You will find that there is only 66 results remaining now. Further, I want only 1 year to be included. I will tick that. Then if I want only the research to be shown here is which are done on human, not on animal or other models. I want only on male or female, you can do that. Or I want, my question was in young children. So I will put this child birth to 18 years, young teenagers. Okay, if you want to more filter, you can click on additional. You can find a lot of filters here, age related. If you want to search only particular journal, you can just go on Medlines, dental journal, nursing journals. You want any specific subject like AIDS, cancer. In language, you can choose language, you can choose sex, you can have an species, and all these, once you do that, you will find that the only 14 results you have. And these results are the most appropriate to your question. So this is why the question is very important. And once you use PICO tool to formulate your question in a right way, then based on that question, you can filter your research here. So it is very easy. We have very less time to read all the article. And I have a very filtered research, which are very, very related to my problem, my question, and I can read this. Once I read this all information, similarly, we have other database, and everywhere, all the most database are more similar to this. So you can search in that. We have very less time. This is why the filter is very, very important. So once you find evidence, then we have to move ahead with looking at whether that evidence applies and whether that evidence is reliable or valid to take it in your clinical practice. So for that, you need to understand the level of evidences. Like most down one, most reliable, what we say, as if many of group of intellectual people and researchers or clinicians together make an evidence-based guidelines. So if you find any guidelines, updated guidelines, look at when it was updated. That's the best resource of evidence. If not, then you can have a meta-analysis and systematic reviews. Then it moves on randomized control trial. Below that, we don't rely actually on the clinical perspective. So all these label, you can just go ahead in detail to understand what type of article or literature you need to search for. Once you find the evidence, the next third step is a very important step. Now you are going to evaluate and critically appraise that evidence to its quality and usefulness. So for that, you have a tool, and you need not to be very, very research kind of thing like that. You need not to be a research scholar to find out the quality and of research. However, you must have some basic knowledge to evaluate that research. And there are a lot of tools available. One of the good tools available here is Critical Appraisal Skill Program from UKCASP, UKNet. You can, if you go on this website, you will find that there are different tools available. You can just download these tools here. For each type of article, there are tools, right? You can print it and evaluate. Like for example, here, CSP systematic review checklist for qualitative research checklist, where you have a other any kind of case control study checklist. So once you get these checklists to find out, it is very easy. You will have this kind of checklist, and there'll be questions written. Did the trial addresses a clear focus issues? So you will have a hint question here. Focus terms in population of study. Intervention was focused, and it is clearly mentioned what intervention has been given. Is there any comparator was included? Is that outcome appropriate outcome assessment scale was used? So all these things you will keep putting here, and at the end you will be able to find out whether this is an appropriate the literature to rely on in your clinical practice, right? So just for example here, let's see. So my question was, does exercise therapy is more effective than manual therapy in reducing LB in 15-year-olds? So I just found one literature, and I'm trying to, in a meta-analysis, and I'm trying to find out. So the ones I download or on electronically on website itself, if I just try to analyze that article based on CISP guideline, appraisal guidelines, yes, I found that yes, the study question, research question were well focused. It was very concise and focused. Author also conclude through literature, and they did some previous study to before having research or particular writing that particular articles. He employed well criteria, study design and inclusion criteria, everything was mentioned. And actually I found that what my age group and other criteria, what was I was looking for. Then ortho state that limitation, so you can clinically correlate that whether that limitation applies to your patient, and concluded clearly that what is the message given by authors. So all these criteria you will find in the checklist, and accordingly you will conclude that yes, 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 no, 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 no. So you will find that whether you are going to rely on that research, that it is valid or usable. But critical analysis of that article help you to rectify the strength and weakness of that particular article, what literature you have found. But what it is not going to tell you that, and what was the result found, this you will get from a literature. But what you're not going to get from that article is that result is specific population, is reliable for your patients. Now your clinical expertise comes here, and it plays a role to decide whether what type of patients you have and what ethnicity. Like for example, you have found that the manual exercise therapy is good in some people, but the patient age matched, but ethnicity and the patient preference itself matter. There your expertise lies. And you have to decide that what is, like for example, some of intervention or tool you found that which is not available to you, then also you have to use your clinical expertise, experience to find out the best alternative for that. You will look for you can further modify your question for search. Then the next important step comes applying evidence in your practice. Okay, so you need to decide if it applies to your patient first, and in specific situation, as I just mentioned, utilizing your expertise and experience, you have to find out whether it is the few of factors which need to be considered. That is similarity between your patients and those patients in study. Then need and willingness of patient. If very, very good treatment, but the willingness of patients and the compliance doesn't come, it is not going to fall. And that may be, you may not find the same outcome as it was mentioned in that literature. Is that results what mentioned was clinically significant, not just statistically, clinically significance. You have to correlate with your experience. Availability of said treatment, what was mentioned in that earlier also, I mentioned that if you don't have that facility, which is you found that it's the best for certain type of patients, so you have to modify your question and again search, right? Availability and feasibility of use of resources in the study. Again, this is correlated with that. When you have resources, whether you have resources, what resources being explained in the article. Okay, so reach to your conclusion, you may need to examine questions related to diagnosis, therapy, harm, and prognosis. As I earlier mentioned, that you need to have a decide that whether you are looking for a prognostic evidence, you are looking for a diagnostic evidence, you are looking for harm, whether this, you have decided, for example, you have decided certain treatment like manual therapy in back pain. So you want to find out that whether manual therapy harm to young children, right? So you will go ahead with that type of evidence. And keep in mind, you must interpret the information based on your skill and expertise. If you think, you may consult your friends, your professional colleagues to discuss that this is what the things you agree with this, and this is what and just discussing, you will have an open brain that to understand whether this evidence is applicable to your practice, your particular patient or not. So as I said, diagnosis, therapy, harm. So if you're looking for a diagnostic, you should look, is the test affordable? Is the test affordable, accurate, available in your facility? Will that test or tool, probably the result of test, change the management of what you are planning for? What is the cost, financial or otherwise, and relative value of alternative test you have to look for. But if you are looking for therapy, that is what clinicians most time look for. Is my patient similar to patients in study? How much patients would get benefited with that? Were result clinically significant? Is the treatment available in my practice or not? Does treatment reflect my patient's need, value, and situations? Is treatment was better outcome as compared to other? So all these things, similarly, if you're looking for harm, you have to look for that the patients, how. These are the questions you have to ask yourself when you critically analyze the literature, and accordingly you can implement in your clinical practice. Now the last step, evaluating outcome. Okay, so this is not the end. In process of executing evidence-based practice, you have developed a clinical questions, how to understand how to use PICO tool to make an appropriate formulated question. And we have searched the answer for the question what we have formulated. We found an article and analyzed that research finding to whether it is suitable for our practice. And we have applied that findings, that literature's recommendations to our patient population. But that's not the end. The process does not end here. EBP means constantly being reshaped by updating, and this is where research born. Because you will have a clinical question, you will look for evidence, you will apply that, and you may not be satisfied with the outcome, and then you will have a further clinical question in your mind that I should have a clinical research, clinical study to find out whether if this is not from as appropriate what I was thinking, the outcome was not so appropriate, then what is appropriate and what is the optimal. So this is the basis, it becomes basis for your clinical research. So you have to look for, was the treatment successful? Is there new evidence recently on topic which you have missed? What's the patient, what was the patient's response? And what new information would help you to make better decision next time if new things has come. So it is a continuous process. You have to keep updating, keep learning, and keeping up to date your knowledge, right? So that's the end of this presentation. And hopefully if there is any question, although it is a one-way communication. So Dr. Harpreet, if there's any questions, so I'll be happy to answer.
Yeah, good evening, Dr. Dharam. I think today we take a very important message from this presentation. And I think all the physiotherapists in the profession, and I think not only physiotherapists, but every professional must know about the triad that you have mentioned, and also about the 5 steps of evidence-based practice. And it is not only important for the therapist, but I think for a better healthcare, these things are important. Dr. Dharam, although the presentation was self-explanatory, there was just a small question that sometimes there is a culture, the culture of taking an article as per your choice and not looking at how strong is it in the hierarchy of evidence. Sometimes a person selects a low quality article and applies that treatment because it is just an article, a scientific article. So, any message for all the professionals, what do they look for in an article apart from the impact factor of the journal?
Yeah, this is why I already explained in my slide that we have to, first of all, we should have a basic knowledge of hierarchy of the literatures. Like first, if we find any updated evidence-based practice guidelines, that's the best way. And unfortunately, we are very, very lacking in that in our country. We need to work upon that. But definitely, there are few international guidelines. We can have insight from those guidelines, and with our expertise and our scenario, we can just manipulate. Next, second thing, we should have a knowledge of hierarchy, one. Then I have mentioned that the CASP tools. So it is a very easy to use. We can download, and it is free of cost available there. It is a PDF format available there. You can just download, and there is a specific question, like, and you have to just tick mark on that, scoring that the page, and there is a guideline also. Once you download that, there is a guideline. What does mean that clearly mentioned subject line? They have very well explained that what you have to look into the article. That means there is a question and there is a description that what you are looking for. Like most of outcome measures, we have a guidelines with that. So similarly, so I would say everyone that go with that checklist, download it, and try to practice some of research, and just compare 2 or 3 literatures articles. Okay, you will find the difference that, okay, yes, this is more reliable and this is, I should not rely. And there are so many of fake journals. There are so many of biased research there it is. Dr. Harpreet, you will agree that in your career, you also must have seen, Dr. Sagun is here and he also must have seen in a lot of students, they do research and I have never seen that null hypothesis of their get proven anytime. And sometimes if it is getting proved, then it is get manipulated. And it becomes like I have made my hypothesis that these things will work beneficially, and I'm not looking for my answer. I just work my research and do my research to prove it that it is right. Okay, so this is the very much problem here, and we have easily available tools. We can go ahead with that to find out.
Right. So I think you are right on target by saying that this culture needs to change, and I think it was a very significant question asked by a participant on YouTube. There is another query, like if you can share some more light on the difference between evidence-based and evidence-informed.
Yes, very, very good question, Dr. Harpreet. And I always, even there are a lot of myths, you will find that those are evidence-based medicine, evidence-based practice. I would say the day it was invented, since then it was evidence-informed practice. But unfortunately, people misinterpreted that evidence-based practice denies or doesn't rely on, doesn't allow clinicians their experience, their intellectuality, but it is not true. Evidence-based practice says that the triad, what I explained, it has to be patient, clinician's expertise, and available information. We have to work in those combined, and since it is implemented evidence-based practices, then it is in evidence-informed practice. So, but just saying name evidence-informed practice itself says that the information you get and apply is, after evaluating, apply is to in your practice. That is what evidence-based practice, or you can say better to understand, evidence-informed practice. A practice which is informed by evidences.
Yes. Thank you, Dr. Dharam. It was very informative and a very useful lecture for everybody to see. Thank you so much for sharing your knowledge and experience with the evidence-based practice.
Thank you, Dr. Preet.
And
Dr. Sagun, indeed pleasure presenting this topic. Thank you so much. Thank you.
Thank you.